Hi, I am Bijish, your friend and lifestyle coach. Today we are going to discuss an important topic, that is blood tests and markers to predict fatal lifestyle diseases like heart attack and stroke. Friends, in today's world, more people are dying due to lifestyle diseases caused by metabolic dysfunction rather than communicable disease. Now, let us look at what are the blood tests and markers by which we can predict and we can save ourselves from these fatal lifestyle diseases. As you know, the lifestyle diseases are caused by the metabolic dysfunctions basically, and which is in turn caused by our imbalance in lifestyle. Now, to predict these lifestyle diseases, there are two category of tests. The first category is blood test, in which we analyze the biochemical variation in the blood, and the second one is the body composition ratio. It can be measured at your home using basic body impedance meters or body composition analysis meters, which are available in e-commerce platforms and very economical rate. You can buy one of those and carry out those tests in your home. Now let us first look at the first category of test, that is a blood test. Among these blood tests, the most important test is fasting insulin levels. As we know, the insulin is a very important hormone in our body, which is produced by pancreas, and which is very important for glucose metabolism. It is also a hormone which is pro-inflammatory and causes fat storage in your body. So the prolonged high levels of insulin in your body causes insulin resistance and other inflammation and causes many other related lifestyle diseases. So the ideal range, when I am talking about the ranges in the following sessions also, the ranges I am referring is the ideal range. In your blood test report, you might see the reference range from maybe from 3 to 23. But 23 is a borderline. We should never aim for that. We should go for an ideal one. So the ideal range of insulin, fasting insulin, is 5 to 7. The second test, important test, is omega 3 to omega 6 ratio. We might be knowing that omega 3 and omega 6 are the essential polyunsaturated fatty acid required in the body, but the key is to maintain the balance. Earlier, it used to be automatically maintained in our body in balance due to our lifestyle condition. Now the lifestyle conditions have changed, so there is an imbalance in omega 3 to omega 6 ratio. So the ideal ratio of omega 3 to omega 6 should be 1:3. The third blood test, important blood test, is vitamin D3 level. We all know post COVID, vitamin D3 has gained a lot of importance. Many of us know that vitamin D3 is very important in bone health, and it also plays a major role in immunity. It has got numerous other functions, hundreds of other vital functions in body. It is also a pre-hormone rather than a vitamin. So it has got functions in heart health, sleep regulation, mood, cognitive functions, then even fat deposition. So the ideal range of vitamin D3 should be 50 to 70. The next important blood test is uric acid. Many of us know uric acid as a kind of crystal which get deposited in our big toe, which causes immense pain. Apart from that, uric acid levels signifies very important parameter in the body functioning, metabolic functioning. So it's also directly, the levels are directly related to our heart health, cancer, incidence of cancer, etc. So the ideal range of uric acid should be below 5. Now the fifth blood test, important blood test, is high sensitivity C-reactive protein, or HSCRP. It indicates inflammation in your body. Inflammation is a response of degradation that is happening in your body. It can be due to some fatal disease in your body. So you must be very much bothered about high levels of HSCRP. Ideally, the level should be less than 1. Now coming to the second category of tests. So far we have talked about blood tests. Now we will talk about certain structural ratio to be maintained in our body. That is called anthropometrics. We all know that body is made up of different kind of tissues like muscles, bone, fat, and there is water content also. So the key is to maintain the ratio amongst each other. So the first amongst these are waist to hip ratio, or WHR. It directly indicates how much fat is deposited in our body, and it has got direct relation with our heart health. And the ideal level to be maintained for male is less than 0.95, and for females it should be less than 0.88. Now the second important parameter in the body composition is skeletal muscle percentage. The skeletal muscles are those group of muscles which are attached to our bones, which help in our locomotion. So it is also an important organ in the metabolism of our body, especially glucose metabolism. So the ideal muscle percentage, skeletal muscle percentage to be maintained by a male is above 40%, and for female it is above 30%. Now the third important parameter in our body composition is total body fat percentage. It is an important factor in our metabolism, and it indicates how bad or good our lifestyle is. And there are different fat percentage, that is subcutaneous fat, that is fat deposited just underneath our skin. There is visceral fat, which is in our viscera or around our vital organs, in our central portion of our body. Now I am talking about total body fat percentage. So for men, the ideal body fat percentage should be 15 to 18. Even athletic person it will be less than 15 might be. And for females it should be around 24 to 26. And for athletic persons it should be maybe even less. And there is one more fat indicator, that is visceral fat percentage. Visceral fat is a fat accumulated around our internal organs, and the ideal visceral fat percentage is around 6%, and you should try at no time it crosses 9%. So these are the important 9 blood tests and markers to identify your health risk towards fatal lifestyle diseases. So just a quick recap. The first blood test was fasting insulin test, that is 5 to 7 mg/IU per milliliter. Then omega 3 to omega 6 ratio, the ideal ratio is 1:3. Then vitamin D3 levels, the ideal levels are 50 to 70. Then high sensitivity C reactive protein, it should be less than 1. Uric acid should be below 5. And structural ratio, waist to hip ratio, less than 0.95 for men, and less than 0.88 for female. Skeletal muscle percentage should be above 40% for men, and above 30% for women. total body fat percentage is 15 to 18 for men and 24 to 26 for females. Visceral fat should be around 6 percentage. These are the important biomarkers, and I advise you to get it checked every 6 months. And if all of these parameters are out of range, you are at a serious risk. If one or two parameters are out of range, you must be concerned and you must get this into ideal range. And if more than 3-4 are disturbed, then you are at high risk. You must think about it very seriously. Your health should be your priority. So friends, if you like or if you find the information shared in this video valuable, kindly like and follow. Thank you so much for watching.